Hey everybody, this is Dr. Sadler here again, and I have our question of the week. When providing nutrition to the client who is recovering from an embolic stroke, what is the nurse's priority intervention? Are we going to, one, provide the client with liquid diet only for the first 24 hours, two, administer nutrition through peripheral intravenous line, 3, consult a therapist to perform a swallowing evaluation, or 4, provide pureed food choices? So first of all, let's break this question down. The person has had a stroke. Now we know a lot of different things can occur with a stroke, depending on the side of the brain it occurs, depending on what area of the brain is affected, depending on how severe the stroke was. Were they able to, get interventions in, such as the TPA? So a lot of different factors can go into that. But this question is specifically asking about nutrition. So what kind of things can happen with a stroke that can impact a person's nutrition? So we know that a person that has had a stroke is at risk for dysphagia. Dysphagia meaning difficulty swallowing. So if that individual has difficulty swallowing, they're going to be at risk for a couple of things. Aspiration pneumonia, as well as altered nutrition, because they're not going to be able to eat appropriately. Now go back to, remember my presentation on the list of priorities to look at when you're answering these priority type questions, and determine, where this one will fall. Okay. You could think of a couple of different things. We talked about Maslow's hierarchy. We talked about nursing process. We talked about ABCs, right? So this could fall into a couple of different things. But looking at our possible interventions here. So remember we said we with nursing process, we want to assess unless in distress. So this person has already had a stroke. And so we're not going to start them on a puree diet if we don't know that's what they need. We need to assess the situation further, right? Administer nutrition through the peripheral IV. Is that something that we need to do? We need to assess the situation further before we say this is what we're going to do, because we don't know what's going on. We just said dysphagia is a possible issue that can occur. So the priority would be to consult the therapist, the speech therapist, to perform a swallowing evaluation. So anytime you have a person that could possibly have dysphagia, you want to consult that speech therapist. That speech therapist can then write further orders. Maybe we need thickened liquids. Maybe we need an altered diet, with minced meats or puree or something like that. Maybe we need an altered diet. Maybe they need a barium swallow, a modified barium swallow, to see exactly what's going on. But you need that speech therapist to come in, first of all, to determine what is going on and evaluate the situation. So our answer here is consult speech therapist to perform swallowing evaluation. Rationale being a speech therapist should perform a swallowing evaluation prior to initiating any oral intake. Further determination about short and long-term nutritional needs will then be addressed.